arthroscopic dissection, and protection of an aberrant suprascapular nerve during massive rotator cuff repair. None of the authors received any financial grants, nor state any conflict of interests for this study. Careful preoperative MRI evaluation in this patient, scheduled for arthroscopic rotator cuff repair, revealed an unusual anatomical variation. The suprascapular nerve was seen coursing above the transverse scapular ligament, indicating an aberrant path. After sterile preparation and draping, bony landmarks were outlined. The posterior viewing portal was established, followed by diagnostic glenohumeral joint arthroscopy. After subacromial decompression via the posterior portal, the arthroscope is introduced into the lateral viewing portal, as well as further decompression and cuff tear definition is performed from the posterior or anterior working portal. Dissection in the anteromedial plane continues until the coracoclavicular ligaments, notably the conoid part, is visualized. The conoid ligament is then followed inferiorly toward its insertion at the base of the coracoid, which serves as a key landmark indicating proximity to the transverse scapular ligament. A Wissinger rod is inserted through an accessory Neviazer portal to cautiously identify and dissect, as well as gently move the suprascapular artery lying superior to the transverse scapular ligament. After identifying the suprascapular artery and proceeding medially, the suprascapular nerve was found to be traversing above the transverse scapular ligament, representing an aberrant course. The nerve was carefully dissected and its path cleared before proceeding with rotator cuff repair of the supraspinatus tendon. The advantages includes: anatomic precision allows direct visualization and confirmation of rare supraligamentous nerve courses, nerve preservation minimizes risk of iatrogenic nerve injury, safe portal planning aids improved access to suprascapular notch, controlled dissection enhances safety, improved post-operative outcomes shall reduce post-surgical neuropathy risk.